good idea to get outside nice and early. Now I'm here with Sarah from the Summit Community Care Clinic, and I'm sure you know it's summertime, Sarah. You got to get out there.
I know that.
Got to get out there early.
Left, don't we?
I know. Oh yeah. Oh man. I hope it's longer than that. Now, tell us a little bit about the Summit Community Care Clinic for people that have never heard of it before or are interested in possibly getting some affordable health care, but they're not really sure how to do it.
So Summit Community Care Clinic is the safety net clinic for uninsured low-income people in our community, and we provide primary care, oral health, and behavioral health services to people who don't have insurance.
That's pretty incredible. Also, I mean, I feel like even if you have health insurance, dental is something that it's really hard to come by, and then the fact that you guys do offer that, and I know you also are very comprehensive with your services. It's not just one thing. You're definitely,
that's right,
you know, really in tune with what people need, and maybe some of the things they don't know that they need.
Mm-hmm. So we do a lot of management of chronic diseases, and we have groups to help people manage chronic diseases like diabetes. So they get tips on exercise and nutrition and things to keep their diabetes under control.
Now, for people that are coming over to the clinic, I think there's probably a lot of misconceptions about how the payment works. So
many people think we're a free clinic. We're not a free clinic. We charge for our services. Basically, we'll serve people at or below 250% of the federal poverty guideline. And this is always surprising for people to hear, but 65% of the jobs in Summit County are in the service industry and are considered lower pay jobs, so $15 about an hour or less. So many of those people work for companies that can't provide health insurance, and that really the people that are working numerous jobs at a fairly low rate are the people that are our clients. So what we'll do is they'll come in, they meet with our eligibility specialist and bring in information about their income, and then we assign them a fee code based on whatever their income is and then how many dependents they may have living with them. And then based on that fee code, they're charged for every service that they get. And we have an 87% collections rate, so people are paying for the care that they're receiving. And I think they feel good about that.
So what really allows you guys to do that? Because I can't imagine that that's an easy thing to accomplish, to have low rates for any type of medical services.
Right. So on average across the nation, it's estimated that we spend about $7,000 per individual on health care annually. And the care clinic, what we've determined based on our budget is that we spend about $468 per individual, which includes primary care, mental health, and oral health services, and it averages about 3 visits per person.
Wow.
So it's incredibly low compared to the national average of individuals for healthcare.
Right.
Really, we couldn't do that without our partnerships and the support of the community. So one of the reasons we can provide services that low is because we have in-kind contribution of our space, our clinic. We also get, for instance, St. Anthony Summit Medical Center provides an enormous contribution in the form of in-kind lab work for our patients. We also have other partnerships where people are volunteer providers. High Country Healthcare, many of their providers have volunteered in various capacities to help us. We have volunteer dentists that help. 100% of the dentists in Summit County have contributed in some way to the clinic's work.
Wow.
We get specialists. Peter Janes is an orthopedic surgeon. He volunteers in the clinic. So we have a dermatologist, we have an OBGYN who's beginning to volunteer. So it's really because people are giving to our clinic that we're able to provide services at that rate.
You know, doesn't that just kind of give you some warm fuzzies thinking about that? Because a lot of times you don't really hear about those things happening in the county, and to know that they are going on a daily basis, and what a way to impact our own community right here. So
yeah, we're very lucky.
Where are you guys located?
So we're in the medical complex by St. Anthony Summit Medical Center, the hospital, and we're on the bottom floor of the medical office building. We have a big blue sign outside that says Summit Community Care Clinic. And anybody that would like to come by and have a tour or learn more about our services is welcome to do that. You can see our website up on the screen, and the web address is www.summitclinic.org, or you can call us at 668-4040.
And there's a picture right there on the bottom of the website. So if you weren't sure exactly where that was, you can see a nice shot of it there. Well, Sarah, thanks for coming on this morning and kind of letting us know what's going on in our own community, especially with some amazing volunteers, and that is very cool. Well, we're going to take a break, and when we come back, we have more Summit Sunrise coming your way, including more interviews, more free stuff that we're giving away, and your local weather. So don't go anywhere. We'll be right back.